Welcome, everybody. We're very excited for this workforce information exchange, and it is my privilege and pleasure to introduce, I can say, my new colleague, Wendy Morris. And for those of you who do not know Wendy, she is a nurse by trade, an incredible nurse by trade, and has spent the last 7 years as Kentucky's commissioner of the Mental Health Authority, Single State Authority, which is an addiction authority, and the Intellectual and Developmental Disability Authority. She has been on NASMHPD's board for many years and on NASMHPD Research Institute's board. And we are very excited to say that she is now with NASMHPD and has brought an incredible amount of resources and expertise. And she's going to be moderating today's session. I'm going to turn it over to her. Wendy, thank you.
Great. Thank you so much, David, for the introduction. Good afternoon, everybody. It is such a pleasure to be here. As David said, I joined NASMHPD. This has been about 10 weeks ago after serving on the board for some time, and just really thrilled to be so engaged in the work that NASMHPD is doing with workforce development. I've had an opportunity to sit in on lots of your meetings with the TTI team, and it's been really great learning more about what you're doing. So much fantastic work happening across the country on this issue. So I'm here today, and I'm just going to start off with talk about a few things, and then I'll introduce some colleagues from Kentucky. So I'm going to start by just sharing my screen. All right, can you all see the slides okay? And I can't see you, so someone will have to tell me.
We can't see them.
Oh, okay. Well, maybe if you can share them, that'd be great. And if not, I'll just proceed without them. So my first slide just talked about kind of what we hope to get out of today, kind of what the purpose is and some of the anticipated outcomes. So of course, the biggest thing we want to do is really create some synergy, right? Really try to get some conversation going that's going to help us really grow the work that's happening out there. So we're going to give folks an opportunity to brag about their work that's happening, highlight some successes that states have had, and then encourage folks to borrow from each other and just to grow those ideas and those innovations in new, brilliant ways that then we can borrow those, right? So just really creating that synergy. We also are going to use the Learning Collaborative as a way to inform some other work that's happening. So one of those things is the NASMHPD Workforce Resource Guide that I've been working on since I joined. Actually, the first draft came out, I think, in the fall and was released to a few select commissioners over the fall and winter. So if you can go to the third slide. Yep. Actually, right there. Thank you very much. So so I'll talk about that in a little bit of detail on the next slide. But the other thing is we want to inform some of the work that's being done by the National Council for Mental Wellbeing. And they actually had a convening recently with more to come, where they got together several national associations, including NASMHPD, the National Association for Medicaid Directors, National Association for State Alcohol and Drug Abuse Directors, National Association for Community Health Centers, county officials, others. So some really great conversation and trying again to get us all creating some synergy. And there'll also be a World Cafe on Workforce Development at the National Council's conference, which will be in LA in a couple weeks. And it's by invite only. And we were thrilled at NASMHPD to be invited to be part of that. I think several states were also invited. So it should be a really great conversation. And so some of the things that you'll be talking about or sharing, questions that you ask, are all going to help direct some of that work and enrich those conversations. All right, next slide. So I want to talk just for a minute about NASMHPD's Behavioral Health Workforce Resource Guide, which I had hoped to get out to you today, but we had just a little bit of formatting that we needed to shore up, but it should be out very soon. And we'll make sure everybody that's on today gets it and goes out to all the TTIs and the commissioners and so on and so forth. So you can expect to see the version 2 soon. It's going to be a working document, so we expect to update it every few months. But It's broken down into several sections. The first few sections are kind of what we would call cross-sector strategies. So these are things that not only those of us at the state behavioral health authorities need to be working on, but we need to have the partnership with Medicaid and public health, our legislative bodies, to make sure we're doing things like decreasing the demand for acute services, assuring that there's adequate reimbursement, not only for the services we provide, but for our staff. We may need to be updating statutes, regulations, policies, because frequently those can create barriers to doing some of the innovative work that we want to do. So the first few pages talk about that. And then we adopted a framework, and actually, as Kentucky will share with you, while I was still commissioner in Kentucky, it's a framework we adopted to do this work. And I just really think it fits well with the work we're doing. And so we took the original resource guide draft here at NASHPD and reconfigured it to go in this framework. And it's broken down into 5 main categories: understanding needs of the workforce. What is it that you need and what's on the horizon that might change that? How do we increase the supply, the number of people that are working in this field? How do we expand the reach through telehealth and other things? How do we address distribution to be sure underserved areas have more providers? And how do we retain the professionals that we have? I do have the source for that framework here at the bottom of the slide for those who are interested. Can you go to the next slide? I did take a little bit of time to kind of look at all the 2023 TTI projects and see kind of where they fell into that framework. So you can see about 13% were interested in understanding the needs, or are working on that rather. 30%, how do we increase supply? And just over half on how do we train the people we already have in place. You'll notice that that doesn't add up to 100, and that's because one state, Kentucky, took a very comprehensive approach and it really couldn't fit into the framework, which makes sense because their project kind of is the framework. And then I looked at, for everybody who responded about participating today, what your interest is, and you can see how that kind of lined up. It was interesting that there was a big shift. We went from 0% of expanding reach to 33%. And I don't know if that might be because of everything we've heard about Oklahoma and what they're doing right now with the iPads and some of that. It's some pretty exciting stuff, but you can see that there was a shift from just keeping the people who already have to focusing more on increasing the numbers of people that are working in the field, the kinds of people that are working in the field, and how we expand the reach of those we have. So I thought that was some pretty exciting and interesting results. All right, that was my final slide. Thank you. So kind of with that as the groundwork, I'd like to turn it over now to my colleagues at Kentucky. We have Executive Advisor Tina Robbins, who actually will, I think, be speaking first. Tina and I have worked together for many, many years. She's amazing. And then Beth Kuhn, who I've also worked with for many years, but she came to work with as a consultant in Kentucky for workforce development. And I've been very pleased to be able to continue working with them on this project in my new role, and excited to have them talk to you today. So I'll turn it over to you all. Thank you.
Thank you, Wendy. It's kind of hard not to say thank you, Commissioner Morris. But thank you so much, Wendy, and thanks to all of you for the opportunity to share just a little bit about our work here in Kentucky. I'm going to tell a little story about how we got started on this path related to a real purposeful and intentional concentration on workforce development. And then I'll talk, then I'll turn it over to Beth, and then she'll kick it back to me to talk just a little bit about our particular TTI workforce initiative. So it really all started with an observation at a CEO meeting probably over a year ago. Wendy was the commissioner at the time, and we would meet quarterly with the CEOs of our community mental health centers, which serve as our behavioral health safety net providers. And at the end of the meeting, as always, she would do a round robin and ask folks to share updates and challenges and successes. And, workforce challenges would be mentioned from time to time. However, at this particular meeting, I observed that each of them, all 14 of them, mentioned workforce challenges. And now, this was before the workforce crisis was really being acknowledged at the federal or state level. And so I pondered the issue for a couple of days, and during my one-on-one meeting with Wendy, I raised the issue with her. And I noted that, while Kentucky has faced workforce shortages for many years, our department, as the state behavioral health authority, as the state, single state agency, as the authority for developmental and intellectual disabilities, we had not really taken on a strong leadership or coordinating or convening role as it relates to workforce innovation and development. And, obviously we had several workforce related initiatives going on. We were, we offered opportunities to increase provider competencies in evidence-based practices. We would create internship programs in certain disciplines like prevention. We were adding new practitioner types like peer support specialists, et cetera, but we had never given real dedicated and what I would say purposeful attention to workforce development. And so I propose that we dedicate staff time to take on a leadership role. And Wendy, she kind of, agreed and smiled and said, okay, who's going to do that? And, knowing that we, like most state agency staff, all feel like we're pretty much at capacity. But we discussed it a bit more and determined that it could fit within my role, because my role as an executive advisor is really around innovation and implementation support. So it was a good fit. And so I set off to draft a proposal for, what this type of thing could look like. And I have to say, I've always been one to see the value in taking a multidisciplinary perspective to solve systems changes. And so I knew three things at that time. I knew this was a complex systems challenge and would require much more than simply a behavioral health lens or behavioral health expertise. It would require, at the very least, evidence-based and evidence-informed workforce strategies. The second thing I knew was that I didn't know that stuff. I didn't have that knowledge, and that we needed to identify somebody to partner that did have that knowledge, or at least knew where to seek that knowledge, and somebody who could help broker relationships with other workforce partners in the state. And so I immediately began to think about my friend Beth Kuhn, who you're going to meet here in a second, because I knew she'd be a great fit for this role. She is an expert in workforce development and had worked with our cabinet in the previous administration. And so I proposed that idea to Wendy, who agreed to support this kind of a partnership. The last thing I knew is that I'm a big believer in being guided by a conceptual framework. And I think having a strategic framework is essential to ensuring that we comprehensively address whatever the challenges that we're facing, and workforce was no different. And so after Beth came on board, we adopted the framework that Wendy has shared, with some slight enhancements that Beth may venture to talk about a little bit today.
Yep.
And so our workforce innovation and development journey has begun. We have several initiatives underway, including our TTI 988 workforce initiative that we'll talk about in a moment. I'm happy to say we're launching our first ever Behavioral Health, Developmental and Intellectual Disabilities Workforce Innovation and Development Collaborative next Monday. And we're very excited to be part of this learning collaborative and to learn from each of you. So I'm going to turn it over now to Beth to share a little bit about Kentucky's philosophy and vision.
Hi, everybody. I'm really excited to be part of this and to be introduced by my good friend Tina. And I think you can tell something right away as we hand the mic back and forth to each other. And that is, we really see this as a true partnership and collaboration between the behavioral health and developmental disabilities expertise that Tina represents and workforce. So I'm starting with the end in mind. I'm going to say that in a few minutes. So hold that thought, because we're going to come back to it. As both Wendy and Tina mentioned, I have a history in Kentucky state government. I was previously the workforce commissioner under 2 administrations ago and 1 administration ago. And in my last year, because I'm a glutton for punishment, came over to the Cabinet for Health and Family Services and worked with Tina and Wendy in the Secretary's office on embedding workforce in human services. And so I'm a big believer in silo busting. And I think that this work that NASMHPD is helping spark with its efforts is a lot about how we can break down some of the barriers between these disciplines and do that interdisciplinary work that Tina mentioned. And so Tina has heard me say this. I think it's the start of our philosophy as we approach this work. And it's that everything is a workforce issue. And it's true for many fields, not just behavioral health. It was true certainly during and after the pandemic. It's true because of demographics as we age, and the cohort that's coming up now is so much smaller. It's true because of technology and the changes wrought by technology and the job skills that we're going to need compared to the ones that we have and the ones that we don't have. So all of those things make everything we see when we walk out on the street every day some form of a workforce issue. And then layered on top of that is our field of behavioral health and the unique ways that what we've got right now are workforce issues. Our product is our people. So their expertise, their knowledge, and their kindness, all of those things make workforce so central to our quality and our ability to serve. And the increase in needs that the pandemic and the societal changes that we have. And I know these are things everyone who elected into this call today knows, and yet we're layering all the real pressures on workforce, right? We're improving, destigmatizing the access of services. That adds to the reality that we're pressuring more on workforce issues. And on top of that, we've got the challenges of a highly regulated field that's too often too lightly paid. And so the pressure around turnover and attracting people and how do we get enough people into our jobs, and we can't pay them enough, and what does that mean for all the strategies that we have and that we need to build. And so I came in to this role as a consultant about 6 to 9 months ago. And one of the first things that we did is we asked some of our colleagues within the department and some of the community mental health centers and facility directors, what are your workforce challenges and what are the strategies that you're employing to address them? And the bottom line answer that we learned is that our existing approaches are not enough. And the way that I've come to think about that is that an HR, a human resource strategy is not enough. A strategy inside the building, if you will, where we think about what can we do differently within our own practices. It's not enough to solve the workforce challenges that we have. And so everyone was talking about a lot of activity around going next door to see if they could entice the fill in the blank psychologist, social worker, whoever it was to come over to their organization from the one next door. And yet that reality of trying to borrow, beg, and poach, as someone used the word a few times in some of our responses, wasn't going to solve the problem. It was a little bit like that proverbial walking up the down escalator. And so that focus on can we make some narrow changes? Can we walk up the down escalator? Wasn't enough to deal with those larger forces at play. And so the opportunity and the need to adjust and innovate within that workforce development ecosystem, the one that says, how do we look differently at education pipelines? How do we look differently at the way we develop talent? How do we look differently in the way that Wendy put up that structure that the National Conference on State Legislatures helped us build around attracting and training and retaining and readjusting the whole system? And so some days we think, we're really trying to boil the ocean here. How is that going to happen? And other days we know that finding that collaboration and that perch for innovation is really going to get us the kind of systems change that we need in order to really build that next generation and future facing workforce. What do we mean by future facing? Looking at those anticipated issues on demographics and technology and the ability to distribute our workforce differently, and think about how we can build that into the way we design our systems and our services. And one of the things, it's just been so interesting to think about the comprehensive approach that we're trying to build. And I'm going to turn it back to Tina in a minute to talk specifically about the TTI workforce package, because I think you'll be able to see that in a more concrete way. But there's a couple through lines. Wendy mentioned a few of them around payment and policy and regulation, that regardless of whether you're talking about retention or recruitment of your workforce, there are issues around reimbursement, there are issues around policy that are through lines. And so we're starting, I call it a 3D framework, but realistically, Tina pointed out to me, it's two-dimensional. And so the need to include other through lines like communications and quality, and I think really critically equity across that framework that the National Conference of Legislatures gave us. We're building that out to really understand how each of those ways that we intervene and build strategies for the workforce can take us to that next generation service model for our clients and our state. And that's an exciting conversation and an exciting place to be for us right now. So Tina's going to make that, I think, a little bit less philosophical and more real by talking about specifically about our 988 TTI project that we're engaged in.
Thanks, Beth. And before I do that, I want to acknowledge a couple of our colleagues that are working on this TTI that I have noticed joined. Dr. Patty Clark and Angela have both joined us today, and I appreciate them joining. And during the discussion, they will probably fill in a lot of the gaps that I miss in describing our TTI initiative. So in Kentucky, we have taken, I think, full advantage over the years of all the TTI opportunities. And so when this opportunity came about, we certainly wanted to jump on it. And I'll just say that as a person whose role it is to engage in innovation in the department, I truly appreciate the opportunities that a TTI initiative offer for that, that no other funding opportunity I feel like truly offers in the same way. So, so we decided in Kentucky when the call came out to focus on our 988 workforce challenges. And our state's crisis call centers, probably not too unlike other states, reported substantial increases in call volume, in caller acuity, and in call time to resolve crises. And this increased service demand, coupled with the severe workforce shortage, really necessitates a transformative and forward-thinking set of workforce development strategies. And so it was incredibly timely that we had just brought Beth on, because again, you know, our belief was that we needed to have a combination of behavioral health expertise coupled with someone with expertise in workforce development itself. And so we are building upon our current 988 implementation and capacity building efforts through this TTI initiative to design, implement, and evaluate a workforce development package for statewide dissemination. And I'll describe in just a minute, show you a picture, if you will, of what we mean by workforce development package. That was kind of a new sort of concept for us that Beth introduced us to. So our short-term outcomes are to facilitate implementation of evidence-based, evidence-informed, and culturally responsive workforce development strategies. And really, a secondary to that is to promote standardization across the state's network of 988 crisis call centers, in many ways as a retention strategy. And so probably also, like many other states, transforming our behavioral health crisis response system, including 988 implementation, is a top priority for our cabinet and for our department. And under Dr. Clark's leadership, we've really been working steadily since the mid-2000s to increase the capacity of our crisis call centers in the state to answer crisis calls from residents in their region. And we contract with our community mental health centers to serve as the crisis call center network. And so we're, leveraging funding and infrastructure and technical assistance received for current 988 capacity building initiatives to really work alongside our TTI effort here. And so what I'd like to do at this time is just show you the picture. And if someone could share the slide, thank you so much, Ava, for sharing that slide. So here's what our package, our 988 workforce package consists of. We have, we're proposing to develop standardized crisis call center staff position descriptions. So that would include educational and experiential expectations. What we know, and Angela does a lot of this work for us as our 988 coordinator, what we know is that the job descriptions across those crisis call centers vary greatly. And we believe that having standardized position descriptions can be helpful. We will also in this process develop recruitment strategies and have model and evidence-based strategies that we will share as part of this package that will include appropriate markets for advertising positions so that we can increase recruitment of staff who have lived experience, as well as those that identify as marginalized or minoritized populations. In terms of onboarding, we will have model language for policies and procedures related to onboarding new staff to create uniformity across the system. We will, in the training realm, have recommended professional development curricula series with in-person and virtual options that can be housed within a learning management system for both 988 call takers and supervisory staff. The fifth component really has to do with coaching, and I'm a big believer in, I'm a implementation science and practice person, and so this coaching component must be in there if we want to ensure fidelity of implementation. And so we will have we will include in this package what supervisory structures could look like that would support ongoing coaching and performance feedback to support call taker competency. We'll have retention strategies included in this workforce package, as well as career pathways for 988 call takers. And so this is really what our major output from the TTI initiative will be. We've already begun, obviously, working on these things. We have convened our 988 workforce implementation team, and we've included individuals from the crisis call centers on that team so that they can serve as the collective voice of the larger call center group. And they have been incredibly important in informing us about what this workforce package needs to look like. Once we have the workforce package developed, we will create an accompanying best practices implementation guide that will be disseminated, and folks will be oriented to that guide. And then we will continue to host 988 peer group meetings across the state so that we can continue to support implementation efforts. But also, I noticed Leah or somebody put this in the chat to have those feedback loops, and that's an important part of any kind of an implementation process, is to make sure that whatever we create in this workforce package that's being implemented, that we have feedback loops from the field so that we know what needs to be tweaked, what needs to be refined, what needs to be changed, altered, adapted, whatever. And the other piece that I'll mention is that we are incredibly interested, and we would love to have conversations with folks from this learning collaborative if anybody is interested, around the research component for this. So we'll be evaluating the effectiveness, obviously, of our workforce package, but we're also interested in a research component that has to do with the relationship between these types of workforce strategies and 988 call center performance, if you will. So for example, do crisis staff qualifications such as degree requirements predict position retention and call answer rates, or other kinds of quality metrics? And so we're very, very interested in that research piece, in showing, being able to demonstrate the relationship between the workforce strategies and the ultimate outcomes of the call center. So that's just a little bit about our initiative. And I'm sure that, as I mentioned, Dr. Clark and Angela will be able to contribute much more about this effort if folks have questions about it. So I think
I just realized when I spoke, just to sort of circle this back to Wendy and bring it home, that the opportunity that all of you have to bring in your workforce, brothers and sisters. We had, Tina and I, the privilege to be in New Orleans in November and go to the NASMHPD event about workforce. And when I looked around and realized I was the only workforce person in the room, I felt that that was a huge opportunity to advance this work by bringing in more of the workforce commissioners, directors of workforce development, the people in states around from the education and workforce pathways, to create not just what we in our lingo call a sector strategy around healthcare, which is how do we build statewide talent pipelines and get stuff going for healthcare, but really around this crisis in behavioral health. And so I just, listening to Tina, watching that whole 988 project slide, thinking about where that's already gone with some new ideas around job architecture frameworks that are more nerdy workforce stuff. It just feels like a real moment in time where we could work across the aisle on some of these issues in a really exciting way. And I'm privileged to be in this virtual room and to help work with many of the states here to sort of cause some good trouble that way. So
Thank you, Beth. Tina, did you have any other closing comments before we go to the group discussion? All right, terrific. So I think Ava's gonna open up the lines, as it were, so we could have some group discussion for the next 20 minutes, 15, 20 minutes. We'll see how it goes. And obviously we want it to be as directed by you all as you would prefer. So if you have questions or comments on this presentation, a few things I'd be interested in is, and Beth kind of just raised it, is, are any other states currently or considering working with any kind of a consultant, or maybe one of your colleagues in the state who has expertise in workforce development? Have any other states adopted a framework, maybe something different than the one that Kentucky did? Interested in if anybody has comments on Kentucky's question about outcome measures, and then maybe other folks could share what's been the most compelling resource that you've uncovered as you've been doing this work, and maybe tell us how it shifted your work. So that's a whole long list. So why don't we start by seeing if there's any questions or comments about today's presentation. All you have to do is unmute, nothing fancy. So here's a question: how simple? And it's from someone here, from Leah here at Nashville. How simple or challenging is it to engage a state's workforce commissioner or workforce board? I think that's a great question. And Beth, maybe you can speak to it, and then again we'll see if anybody else on the call
This is
has made an attempt.
Yep, this is their job. So it really should and usually is, in my observation, as simple as picking up the phone and saying, we are really challenged in our department, field, state, wherever you are, by workforce, and we would love to work with you to think about how we might address it. So I would be surprised if there weren't some level of positive response to that. Now, part two of that is, in a lot of states and in local areas that have workforce boards, there's a priority toward high wage, high growth, high wage industry sectors and occupations. And so in my years of working on workforce, that has sometimes, for example, minimized the work that's gone on around early childhood, because while we're desperate for workers in early childhood, those occupations are so low paid that oftentimes the workforce boards and workforce authorities shy away from workforce development on them. And so I think the only challenge might be on the wage issue. And honestly, guys, we got to be talking about that as states, and the workforce people need to be in that conversation. So that would be, Leah, I think the only issue, I think, where you might get a little pushback or angst. And I think I would go back to my first answer, which is it's still their job to help us solve for this. And so that's the collaboration that we really need to take this into the future and to the next level.
Yeah. Of course, I'm sure it's different in every state how easy or difficult it is to try to work across cabinets and departments. I know there's
It is. I think the governors set
favor
the
that, and
tone for that.
administrations who discourage it. Yeah,
That's true. But then there's the top of the heap and the back channel. And I also worked in the state of Vermont in state government. So I've worked in Republican and Democratic administrations in two very different states. Sometimes you can go above, in front of the curtain, and sometimes you go behind the curtain, but there's all kinds of ways to collaborate. That's what I'd say about that.
great answer. Thank you, Beth.
Wendy, this is David. I'm hearing different things across the country that, I think one of the things that the pandemic has done is made us think out of the box on how we work and what our workforce looks like. And I know, like, for instance, I live in California, and there's a big shortage of teachers. And there's many schools across the state that can't fill classrooms. And there's a bill in the legislature to go to a 4-day school week. The kids would still come for different types of things on that Friday, but the teachers would be off on Friday. And it's kind of getting some momentum. I mean, there's a lot of pushback too from different groups, but it's kind of out of the box thinking. I mean, kind of like, I know the Oklahoma example of Grand Lake Center, giving everybody every other Friday off as a mental health day full time. And, their center has a waiting list of people who want to work for them. So I'm also just curious if anybody else out there, if there's some legislative approaches, or people are, going to, we're probably not going to get the salaries to attract, So are there other things that are attractive besides funding? And I know, I worked for state government in Texas for 14 years, and the big attraction was the benefits. It was a great benefits, had a great retirement package. They've taken that away since I left the state government, but that was also a way a lot of people retained because they knew that they had that great retirement package. So states may also have to start going back to some of that.
Yeah, and as far as what's happening with legislation, the framework that I talked about, all of their examples are about legislation in states across the nation that were trying to address this issue because their audience was legislators, right? Which is one of the reasons that we adopted and that I suggested we adopted it at NASMHPD. So we kind of start to develop this common language with people who have a very different authority and power than we do, right? To kind of put some things into law. So that's it's an
And it's a
important
great
piece.
point, David, about, I mean, I think that's where we circle back to innovation, right? Because we're not ever going to solve for this with money. We're just not. Now, the good news is the research says it's only one of the top reasons people leave their jobs. And culture and autonomy, there's a lot of ways that you can retain people that are not only about money, right? And innovation. And before Wendy left, when she was still in her commissioner's chair, we were talking about what are the buckets of innovation around flexibility, around other forms of benefits, around collaborative work teams. And so I think that future facing view involving the next generation of workers that can get us experimenting with other ways to attract and retain people, asking out of the box thinking, we got to do that because we're never going to be able to reach into our pockets and pull out piles of cash to solve for this.
Yeah, and I know Amy's on the call. I'm not sure who else might be on that could speak to this, but some of the other innovations have to do, David, to your point about who's on the team, right? So not just peer support, but what other things, what other roles is our peer support specialists very capable and competent of filling, right? So that we decrease our reliance on these very, high-end mental health professionals when we can have such really good outcomes, right? There's research that shows that if you can get peer support specialists involved early, you're going to see a decrease in hospitalizations. You're going to see a decreased readmission rates. You're going to see people better able to, self-regulate. They make social connection. There's just all kinds of benefits to that. There's things a lot of states are doing too with liaisons and navigators and community health workers and folks that aren't peer support specialists, but again, they're people who know the community or they know the system or they know, something else that maybe your PhD level psychologist isn't in touch with, right? But they can help people get to their appointments and get their medication filled or just have somebody to talk to, right? Just to communicate with. So all of those things are really important. Telehealth plays a big role in how do we reimagine. And I think that's definitely part of the future is thinking about what does our workforce not only could look like, but needs to look like so that we shift our paradigm, our system of care paradigm upstream. Let's focus more on prevention, early identification, early treatment, getting to folks before they're in, a crisis that demands intensive and high-end services.
So Leah, I saw your question about peer support and involving workforce. Peer support specialists, Tina knows this, I could talk about this for a really long time, and I know we're time challenged, but right now there is no occupational code for peer support specialists. So our data on peer support specialists is really lousy, to use a technical term. And so different states are currently counting where their peer support specialists are in different occupational codes. And so this is an example of exactly why we need to work together across the silo aisles on this stuff, because it's going to be years, because it's a federal system that creates occupational codes before we can fix that. That means we got to get the behavioral health problem solvers and the workforce problem solvers together to figure out how we in our states want to be counting what these guys are doing and growing that capacity and giving them more. So back to that NCSL framework, giving them, expanding the reach of professionals means let's see if more duties can be assigned to some of those new categories that Wendy just mentioned. And so it's a perfect issue for collaboration across different rooms that you sit in and authority you have to make change. So
Thanks.
And Beth, we're involved in that. I wish Amy had to jump to another call,
Oh,
but she has been working with a group of peer advocates, and they are working
Dana.
with the department. Yes, absolutely. So,
I'm in the conversation with Dana too.
okay, and
Yep.
so you know, we've also reached out to SAMHSA, asking them for their help behind the curtain, to see, because it's a big issue, and I think that it just makes sense that if you don't have enough capacity to fill what you have in front of you, if you can diminish what's in front of you, and keep people from not coming back every week, maybe once every 2 months, maybe the staff levels you do have will be able to meet
I'm
a lower.
okay.
Yeah,
Right.
exactly.
It's transformational, right? It's transformational.
Sorry, Wendy, I
Yes.
cut you off.
oh, no, you're fine. No, we had a really great question from Faisal in Virginia about implementation science. And I know, Tina, you suggested he email you, but if you could send those resources to us here,
Oh, yeah.
we will get them out to everybody who's on the call. I can't say enough about implementation science. It's really so much more than a buzzword. It's so important to really be able to do really good work. And I used to always call Tina, we used to talk about science soup because she knows all the sciences. Implementation science is like one in her big old bucket. So
Yep.
she's all about the evidence and the proof and but if you could say just maybe a couple words about that, Tina, a couple more words.
Yeah. Well, so one of my favorite things about thinking about the importance of implementation is that, in the human services field, and Beth alluded to this earlier, humans are the intervention, right? So we have to make sure that our humans, our practitioners, the people that are implementing practices are competent and are supported and are doing things with fidelity. And so that's why when I learned about implementation science and the translation of that science into real practical strategies, it changed the way I think about everything. And so I happen to adhere primarily to the active implementation frameworks presented by or shared by the National Implementation Research Network at UNC Chapel Hill, but there are certainly other implementation frameworks that can guide the work that we do and the way we support practitioner competency and the way we create hospitable environments within which people work so that they can do things to fidelity and with fidelity and integrity. And so, yeah, I'm happy to share some of those resources that I found most helpful. So,
Because we don't want to just spray and pray, right? Just
no, that's
give
right.
people a bunch of information and hope it works.
That's right. That's right.
Oh,
That's one of my
hold on.
favorite sayings.
It is.
Well, and I know nothing about implementation science until I started working with Tina, but we've really had an aha together working on this about how much of that, when you look at it together with workforce, is about workforce. So it's been quite
it is
fun to look at that framework against our workforce frameworks and the work we're doing and say, wow, these things are really connected in ways that none of us could see alone.
alone. Yeah.
And I would say it was embraced pretty wholly by our cabinet too, because I mean, you've done education for Medicaid and for community-based services and our community health centers. And I mean, just to kind of, it's a very popular topic. When people hear a little bit about it, they frequently want to know more. So really beautiful to see the interest in that. Other questions or comments about this? Anybody else from our team want to go ahead?
This is Bill Hogan. I'm a consultant working with WICHE, Western Interstate Commission for Higher Education, but I spent 20 years in Alaska. I was the director, Division of Behavioral Health, Commissioner of Health and Social Services, among other things. So one thing I wanted to mention, it goes to the importance of coaching or supervision. People don't leave their jobs, they leave their bosses.
Yeah.
And so I think that focus is a big deal. I'm also wondering if you could talk a little bit around visioning what the system is going to look like 15 or 20 years from now. So you're preparing people, I mean, we're in crisis, so you're preparing people to work now. But frankly, by the time, I don't know, they graduate and get ready to go into the field may look different.
Yeah.
You know,
Talk a little bit about that visioning.
and I'm going to say a word about that because we tried to address that in this latest version of the resource guide. And that is that in part, we have a responsibility to vision what it should look like and develop a workforce that is going to help us get there, right? So when you talk about enhancing the role of peer support, when you talk about bringing on other kinds of roles like navigators, when you talk about how do we use technology to increase reach, about shifting that paradigm upstream, what's really scary to me, and I've been doing this work for 3.5 decades, is that we're really trending back towards beds. There are so many states right now talking about we need more beds, and I've shared this view with several people, and I don't know that everybody agrees, but to me, the beautiful silver lining of the awful pandemic was that people were like, oh, behavioral health is important. That's really true, that there is no health without mental health, and maybe I shouldn't be so, adverse to getting help or calling. But so what's happening is now we have a whole lot of people who are willing and ready to go get therapy. I mean, between my fiance and I, we have 6 kids, and I think 5 of them are, like, well, they have a therapist, they have somebody they talk to kind of help them through, which is great. I love that they want that kind of coaching and help. But those behavioral health professionals are no longer available maybe to the people with serious and persistent mental illness, or the people who have co-occurring mental health and IDD, or to some of our really troubled youth who have a trauma history and aren't coping well. And so we've got some of the sickest and most vulnerable people that are being boarded in our emergency departments. They're on wait lists to get treatment. And so I think from my view, we're trending back to, okay, so let's take those folks and put them back in congregate settings, because all our resources are getting used more and more for I wouldn't say the word well. I mean, there's been, I think, a big uptick in depression and anxiety, and there's things that people legitimately need to have spend some time and energy trying to work on. Need medication, need to see behavioral health professionals. I don't want to minimize that in any way, shape, or form, but there's a lot of new pressures, and I worry about that. But I think we all have a responsibility to shift away from, because beds are kind of the easy thing. They cost a lot of money, but you put somebody in a hospital, and are they getting better, or are they just being re-traumatized? So I don't know that answers your question, Bill, but to me, we have a responsibility to create that future system, and how we develop the workforce can impact that. It's going to work both ways.
And I think in a really simple way, Bill, like in our project, we're saying we have to do some human-centered redesign with the people who are stepping up on our WID collaborative, our Workforce Innovation Development Collaborative now. That means from the customer base and the staff base. And that means we got to ask the incoming staff, who are next gen staff, and not just us older folk who are going to be out the door by the time that happens. What does that vision of service in the future look like? We know it's going to have technology all the way through in ways we can't even imagine now. So place-based is going to be different. It's still going to be place-based, but like we need to be willing to unleash our imaginations in a human-centered design way in the kind of projects that Kentucky is running and do it now and repeatedly and be asking and not write off the answers, right? And that's a really hard thing because there's all kind of restrictions and roadblocks and walls in my world and the behavioral health world that make it hard to do that. But it's really incumbent on us to try.
And we are very close to the end of time, but I would love your reaction to that, Bill, before we close up.
No, I think you're absolutely right. We've got to be asking young people what they envision the system is going to look like. And also making sure that the consumer, the folks that are being served, to make sure that they're heard, their family members, et cetera. So I'm with you and I appreciate your response.
Those are some really good points.
There are a couple of things I think that have come out of this, which are pretty amazing. We have 24 TTIs that are focused on workforce. If we wanted to ask all of them what their visioning is for the workforce of the future, we can certainly do that. And I think people would offer up what their thoughts are. We can ask them how many of them are working with their workforce commissioners or have thought about reaching out to see what that might mean or might give them some tools in their toolbox to do so. And how many of them are working with implementation science.
Yeah,
So
I love that, Leah. It's a great idea.
That then gives them the opportunity to say, I don't know what you're talking about. I've never heard about it. Can we talk more?
Another session.
And I also really love, because Bill put it so succinctly, right? What could we do to ask the younger generation how they envision it? Because I feel like we recognize the importance of talking to people who have lived and living the experience, but do we recognize the value of calling out young people to say, so what do you want your future world to look like, and how can we help create that? A world you want to work in, a world where you're comfortable with the treatment that's being provided. As to my point, I've got 6 kids in their 20s and 5 of them feel like this is a service they need. So if we don't grow it in a way that, is helpful to them, then we've kind of missed the boat. So I know we only have 3 minutes left. This has been fantastic. I hope that folks will consider having more conversation with us in the future. Maybe we'll have a bigger group, but which would be fabulous too. So a couple things that I wanted to leave you with. I'm hoping that you'll get the resource guide before our next meeting, which is May the 18th, and would love to get your reaction to that at the next meeting, or maybe it'll be part of what we send out that Leah talked about. And I also, just for food for thought, homework assignment, as it were, maybe to think about, to pay attention to if anything shifts in the work you're doing based on this conversation today between now and the time we come back on May 18th. So I'll my intention is to ask that at the top of the meeting, what has shifted for you in your work, and maybe that's that you read the resources on implementation science. Maybe that's you had a conversation, decided you want a focus group with the youth in your state to talk about how this could work. Maybe you reached out to the commissioner for workforce in your state. It doesn't have to be a big thing, right? Your world doesn't have to shift, but was there something in your approach that shifted because of this conversation? And that's to help us with future collaboratives, not just this one on workforce, but ones for the future. So again, this has been really great. I think we've got some good upcoming. I think Louisiana is going to be with us next time to talk about how they developed their crisis worker training. I think TAC is going to be with us for a couple meetings. We've got some other things in the works that we're hoping to bring to you, but also would love to hear from any of you who feel like you've got something rich that you would love to share with the group. If you are ready to brag, we are ready to hear it. So we really want to create as much synergy as we possibly can.